Hello my friends. Today's going to be a great day. We're so excited to do our measurements and take you back for surgery. So today we're going to make a non-binary chest and with nipples, correct? Now we talked about different incision types. I want to verify that with you. I can make it straighter, more curved, really curved, follow the pack. What's your preference still?
I think something kind of in between following the pack and a straighter, kind of right around the bottom of this.
Of course.
Does that make sense?
Yeah, we'll aim for that. And would you prefer it to be more male looking or more shapely and contoured, or do you just want it more flat as a board?
Not flat as a board. I think
Okay.
a little bit more contour to it.
Good, that's what I have in my notes. So we'll make it more contoured, but not breast-like, more pec-like. And then we'll make you an incision between straight and pec, but try to follow that pec line for you. Sound good?
Yes.
Awesome. Let's have you stand here, we'll do our measurements. So the first thing we're going to measure is we're going to mark midline. So how do you keep your hands to your side, my friend? Perfect. And we're going to feel this sternal notch here, and we're going to go all the way down. Now we're going to mark the mid chest line. Now we're going to mark the fold. Hands on your hips. Thank you. And now what we're going to do is we're going to have you give us a T like this, so we can measure how much skin we can remove. Super, that's perfect. Okay. Marking the top of the areola. Good. We're going to measure how much skin we can safely remove. And our plan is to do the surgery today with no drains. I don't like drains, they drain stuff. I'm going to connect some dots. Good, hands on your hips again. It's gonna look amazing. Bam, what? Another one. Today we're going to be doing a double incision top surgery with nipple grafts. Our patient is non-binary. They are leaning more male. So what we're going to do is we're going to remove the breast tissue, we're going to remove the skin and the nipple. During the surgery today, we're going to create a more male chest. Now this patient was assigned female at birth, but their identity is non-binary. So we'll make incisions today that are the patient's preference. When I do the surgery, I let the patient pick. We can make them more straight, more curved, follow the pec or something in between. The patient today desires an incision pattern that's between following the pec and straight, so we're going to aim for that. Can't guarantee it, but we're going to aim for it. We're going to remove the tissue. We're then going to remove the nipple, resize it, reshape it, reattach it, and create a more non-binary, however, leaning masculine physique. It's going to be an amazing surgery. Let's do it. So you're going to put numbing fluid in. Welcome to the operating room, guys. It's time for a non-binary chest. Look over here, amazing patient, assigned female at birth, non-binary. What are we gonna do? Remove the tissue, male nipples, more male chest, non-binary. Let's do it. All right, friends, our first step in top surgery is to remove the nipple. So I have my special template made to my specifications to give the most roundest and best nipples that are possible. Then we're going to gently dissect the nipple. We're doing what's called a free graft. What that means is the nipple is going to be removed. It's going to be treated off the table and it'll be reinserted on the same body. It's called an auto transplantation. Auto means I'm putting it back on the self. We're going to be doing disruption to help the numbing fluid spread everywhere. We're also releasing the tissue so we can pull it and reshape the body. You have to remember, it's not just this is female, the whole chest is female. You gotta treat the whole thing. I'm undermining the tissues, releasing everything so I get a more male contour. Now that we made our incision, our next step is to dissect the tissue off its attachments to the pectoralis major muscle. We're going to clip the tissues together. I'm going to get any other bleeders. And now what we're doing is we're reapproximating the tissue, and we want to make sure there's no dog ear. And we're going to reapproximate it very evenly. So some people will just start putting their sutures in. I don't believe in that. I think you have to measure and make sure things are marked properly to give the patient the best symmetry. And you want dog ears. Fire stick. So there's a little bit of leftover skin here. So you can leave it and most people are okay with it, or you can just clean it up and fix it at the same time. And I believe in fixing it at the same time. The skin is removed. Now when we clip it, you'll see there's no extra, perfectly flat.
Alrighty guys, we did it. Here's where we started. We did a chest reconstruction for this lovely patient. Here's where we started. We sculpted the tissue, moved the nipples up, and shaped them. Let's go take a look. Here we are, beautiful flat chest, short incisions, nipples moved up and shaped to be smaller. We did it.
Nice to see you. Things look like they're healing fantastic. We'll take a gentle look at everything and make sure you're in the right direction. I know we did your surgery drainless. How has that felt?
Great, yeah.
Have you noticed any discharge?
No.
How's your range of motion been?
I've been pretty cautious and limited, but it feels okay. Like I can definitely tell when to stop. Whatever, otherwise I've been able to function pretty well.
Awesome. And you've been keeping the binder on?
Yes.
Awesome. Let's take a look, bud. I'll have you stand up for me, please. Thank you. Wow.
Dude, yeah, I know.
It looks really good. Looks amazing. You have a little bit of skin irritation in one area, and that's okay. We'll take a gentle look at that.
Okay.
There's a little bit of redness and irritation here.
Mm-hmm.
Good. There's no fluid buildup. Super. Excellent. Incisions are nice and short. It's the pattern you wanted. It looks fantastic. The nipples are 100% alive. The grafts are healing. Super. Have a seat, bud. So you don't, after today, you don't need the binder anymore.
Okay.
Okay, you're healing super well. We're going to check on you in 3 weeks. Until 3 weeks, we continue the restrictions. Okay? Okay. Things look great. You want to try to keep your arms down below shoulder level. T-Rex. Okay? You have a little bit of irritation on that left side below the nipple. Sometimes that happens from the binder, from the tape, from the surgery wash. We'll keep an eye on it, but nothing to worry about. If you notice drainage, increasing redness, or peeling, give us a call.
Okay.
Otherwise, things look amazing. You look ripped.
I do. Thank you so much.
Thank you. Thank you.
I really appreciate it.
I appreciate you. So let's do a follow-up in 3 weeks, okay?
Beautiful.
Thank you.
Cheers.